Okay, good afternoon. I'll call to order the February 15th, 2021 regular meeting of the Haywood County Board of Commissioners. Our first order of business will be our Pledge of Allegiance, and after that I'm going to ask our pastor, Josh Frazier, to come forward for invocation. So if everyone please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Let us pray. God in heaven, we thank you for another day. We thank you for each one that is here today to help make decisions that would allow us to live the best life. All of us together, working together to live the best life we can. We pray that you would give each one of us understanding and guidance through times, and we pray for unity within our community so this would be made known as the best county in the world to live in. We thank you for the rain, which brings life. We thank you for this evening, and it's in your name we pray. Amen.
Thank you, Pastor Josh. And Pastor Josh was here last time. He got here just a minute or two late, and I didn't look at my time, or else we did a moment of silence. So I appreciate you making an effort to come here last time. I know the weather was bad then. Thank you, Pastor Josh. Okay, we don't have any public hearings tonight, so our next order of business will be the public comment session. And so we'll let each person have 3 minutes to speak, and if you would, Tracy will be keeping the time there, and she'll let you know when your 3 minutes is up, and I would just ask that you conclude your remarks after that. And when you come up, there'll be some hand sanitizer and then some wipes if you'd like to wipe the microphone or use the hand sanitizer. And I do have a few people that have spoken up, or rather that have signed up to speak tonight. And our first speaker will be Victoria Castle. And welcome, Victoria.
Hi, good evening. My name is Victoria Castle. Thank you for the opportunity to present my concerns regarding the new jail. One reason I chose to move to Haywood County is because of the communities in which we live. With a farming background, I felt at home poverty and create more barriers for them in the future. After their release, people often face great difficulties in acquiring shelter, work, and even higher education. It is senseless to isolate members of our community by packing them into a new jail. This will only aggravate any issues a person such as substance abuse and/or mental health concerns. Community with proven solutions. These include placing licensed clinical social workers in all Haywood County middle schools and high schools, trauma and resiliency training for our community, crisis intervention team training for law enforcement, multiple rehabilitation options, including mental health care and housing assistance. Instead of $16.5 million allotted to build a new jail, why not choose life over punishment? We propose allocating only $1.8 million to provide mental health and substance abuse treatment and prevention services, $1.5 million to housing assistance, and just over $73,000 for the crisis team training for law enforcement. As our elected officials, you know and accept that by building a new jail, more and more of our neighbors will be pulled into the vicious prison cycles that many are never able to escape. It is up to us as members of the community to stand up for our rights and determine how we will create a thriving Haywood County for our future generations. Down Home has reached out multiple times regarding our concerns and this budget proposal, but have not had any response from the board yet. I'd like to schedule a meeting with you to address these issues as soon as possible. Thank you so much for your time.
Okay, thank you, ma'am. Thank you, Ms. Cox, and thank you for the information. Okay, our next speaker will be Reverend Peter, and I can't pronounce your last name. If you would, sorry about that, but welcome. Appreciate you coming out tonight.
It's Constantian.
Constantian, okay,
Yeah.
thank you.
I've also submitted my comments. This is my partner, Emily. She's going to hold this sign up for me, if that's all right. I've submitted my comments for your review. Good evening, Commissioners and Chairman Ensley. Thank you for the opportunity to address you all this evening. My name, like I said, is Peter Constantian. I'm the son of a licensed clinical social worker who spent her career working in a federal prison where many mentally ill people were incarcerated. As a child, I saw how the work she did affected her, my uncle, who was also a corrections, her and my uncle, who was also a corrections officer at the same prison. Here in Haywood County, I serve as a local pastor for 2 small Methodist churches in Canton. But I'm here on my own accord, not representing them or my church conference, but simply out of my own convictions as a Christian and as a citizen of Haywood County. I'm here tonight to speak a word of caution to you as you evaluate the plan to more than triple the capacity of our relatively new, which was built in 2005. I chose to serve Haywood County, and I love this place because I care about the people who live here, as I know you do. I believe that our county's best are yet to come, and I often pray that God would make the kingdom of heaven visible here in Haywood County. I believe that God is calling this county to be a place where all people have access to the care that they need, where good, stable jobs are plentiful, and where community groups like my churches are active. And when all those 3 things are happening, I believe that there will be no place for poverty, unemployment, despair, hopelessness, or addiction to drive people to the kinds of petty theft and larceny that we've been seeing more of lately. I am committed to working hard towards this vision with you, my fellow church leaders, business leaders, and law enforcement. But if we are to make progress towards a future Haywood County that God desires, then the decisions you make on how to spend our limited taxpayer dollars really matter. This poster that Emily's holding claims that the true cost of the jail is not contained in the $16.4 million that has been projected. Instead, we project the true cost will be closer to 10 times that amount. Our research shows that the cost of bigger jails is not the physical structure itself, but the cost of employing additional corrections officers, which the sheriff has said we need to pay more anyway, and providing mental health and medical care to those who are detained. But the cost I'm concerned about is the moral cost. How would Jesus spend $16 million in Haywood County? The decision to triple our jail capacity is not simply a budgetary issue. Rather, I believe that it reflects our expectations and goals as a county. I'm begging you to consider to spend the money differently. My colleague Court Green and I, pastor of Canton First Baptist Church, met with the sheriff last week, and I continue to speak just because I know that this is so important to all of you. In our conversation, Sheriff Christopher confessed that 88% of folks who come through the detention center are either suffering from mental illness or substance abuse disorder. Greg explained that since our behavioral health urgent care closed as of last April, that there is simply no other place for people to go. A tripling of our detention center's capacity would solidify the role of the sheriff's office as our de facto inpatient mental health facility in this county. And regardless of where you stand on the proposal, I hope you can agree that incarceration is not a good treatment for mental illness. I asked the sheriff whether he even wanted that role for his officers, and he said no. My guys are trained as corrections officers. They're not trained as mental health counselors, therapists, or social workers. Chairman Ensley and Commissioners, I came tonight to speak a word of caution to you as you discuss the plans to expand the jail. I've mentioned how the official price tag is deceptive and it doesn't reflect the true costs of running such a facility. But the true cost that I'm most concerned about is the moral cost. I know from my upbringing how heavy the toll is on those we task with keeping mentally ill people behind bars. The expanded jail would not bring us closer to God's vision for Haywood County, and it will cost us far more than money. The representatives of Down Home Haywood have contacted you to talk about an alternative vision for this year's budget, and I would like to ask you to commit to meeting with us and working towards a budget that reflects the hope we have for our county. Thank you for your time.
Thank you, Pastor. Okay, and our next speaker will be Casey Stephan. Welcome, Casey.
Hey, I'm Casey Valentine Stephan. I'm a community health worker. I'm going to take this off. I'm going to take this off because I am fully vaccinated as a healthcare worker, thanks to Department of Health and Human Services. And that's kind of what I want to talk about today. These opinions are of my own. It doesn't represent any entity or organization. It's collective lived experience from working with organizations like Down Home and the Homelessness Task Force in the town of Waynesville, and being a county employee for several years and working in private practice and going to church with y'all and school with y'all. So this is kind of my lived experience. And over the past couple of weeks, I have talked to several people about the COVID vaccine sites. And what I saw with that was we had our Department of Health and Human Services, and we had for private health care, and we had our faith-based sector, and we had businesses all work together in this massive community push to protect people. And what you may not know is being in healthcare, a lot of my colleagues are, they're scattered all over the country, and so we talk about this a lot. And so to hear their accounts of what's going on in their counties, I wanted to come here today and say, bam, like we're rocking it, like we're doing these things. And it was this collective effort. And everybody I've talked to that's volunteered and worked those events has said, well, like people at the health department were like, well, if it wasn't for people on the social services side helping us with this, and if it wasn't for the hospital doing this, and if it wasn't for Angelo's bringing us pizza, like it wouldn't have been that smooth transition. And so I wanted to brag a little bit about that, because sometimes I come up here and I'm a little ragey and a little angry, and so I want y'all to know that sometimes I can be pleasant. But the point that brings me to is community involvement, which is kind of what the Down Home people are talking about. Community involvement with these populations that I have come and discussed over the past year or so. I came first when COVID started because I was kind of in a panic. I was a public health care worker, and I was out on the streets, and I think everybody was kind of up in arms, and I was hearing rumors that we were sending money back, emergency funds back to the state. And so then the unofficial response I got for that was we don't want to be responsible for that money. We don't want big government in the pot. And so to that I say, okay, I'm a multi-generational mountain person. I get that. Like, I appreciate that. All right, so then I come and the emergency centers closed up Balsam, and that really put a damper on services, and I had this population that I could serve there, and I will quickly sum this up. To serve this population, and I came and I said, hey, why are we down? And the unofficial response I got there was, well, we're not in the business of that. Money. Okay, I get it. I've lived in poverty. I know what it's like to be, so I get it. And so over the course of the year, there were several other things that I came and I talked about public health, about counselors in schools, about working with people with substance use disorder, people living through the looking for affordable housing and the housing crisis that we're having in our area. And all these responses were met with well, we just can't do that. We're not in the business of that. We don't have the money in that. So what I'm here to say is that in the paper, I believe that it was Bryant that was quoted in saying that we're in a really good position to do that. And if we are, I trust you and your judgment, but if you're going to put your head in the sand about all these other things that our healthcare workers are talking about, that the task force is creating data, that people in Raleigh are calling to find out, like, what's Haywood County doing, what's going on there, then you might as well, like, jump it from 5 to 100 to a dime to 100 and go ahead and, like, double it to 32 million, because that's where we're going to be in like 10 years. And that's just my opinion as a healthcare worker, that before you make these decisions, and I've sat in on many county budget, I worked for the county, I was a federal employee on contract, I get it, but I just need to know you guys are going to reach out to the people on the task force. You're going to reach out to all of the people at Meridian that I've talked to, that the nurses at the schools and the social workers, and you're going to listen to them before you make these decisions. Because, like he said, just a word of caution, we're a little bit nervous. $6 is a big amount, and got a little distracted because I got excited thinking about how Jesus would spend $16 million. So I urge y'all to kind of think about that too. Thank you.
Thanks, Casey. Okay, our next speaker will be Billy Simmers. Welcome, Billy.
Good evening, Commissioners and Chairman Ensley. Do appreciate the opportunity to share with you some thoughts. I'm Simmers, and I live at 250 Cortlandt Court in Waynesville. I moved here from Connecticut about 2 years ago to be closer to family. I have been very impressed by the supportive, community caring people in Waynesville and surrounding towns as well. And this is a great foundation upon which to build supports to provide a hand up when our citizens are in need. With a hand up, individuals can develop, overcome situations that cause barriers to successful living. In Connecticut, we had several services, and I do understand two different states, a lot of difference I'm learning about North Carolina. But we had a mental health services where social workers were assisting with integration back from inpatient stay or from incarceration. And in that program, we had supports for housing, getting case management, and I do know that you have much of this here in the Waynesville, the Haywood area. We had a jail diversion program, connected individuals with resources before the court hearing. So when they went into court, they had answers. Didn't have to just say, sorry, does anybody have any information? Well, if no, then it's a sentence that the person has to live with. We had a program, community intervention team, that provided training to various community organizations and also provided resources in the community when there were issues around people having difficulty and needing supports and resources. In summary, there are resources that we could learn from, and then our legacy, your legacy, will be noted as caring for our neighbors as well as being positive role models for our children and grandchildren. Thank you for your time.
Thank you, Ms. Simmons. Appreciate you coming out. Okay, that's all those people I have that signed up to speak. Would anyone else like to address the board tonight? Seeing no one, I'll close the public comment session. Okay. We'll move on to constituent concerns. And Brandon, do you have any that you'd like to comment on?
No, I'd just like to thank the folks that come and share their concerns with us. You know, all that'll be taken into consideration when we make our decisions. So thank you for taking the time out of your schedule to come and share your concerns with us. And don't have anything else other than, again, I just want to thank all of our county employees, our staff, all the volunteers for our vaccinations on a daily basis. I was almost late for our meeting today because I was in the office with the gentleman that was bragging on how well we're doing as Haywood County. So even though I don't have a lot to do with it, other than supporting you guys, I appreciate the efforts that's been put forth, and it makes you swell up with pride knowing that you're part of a county that's setting the bar for other counties. So thank you for what you do.
Okay, Kirk, have you got anything?
I did have several reports on the vaccination process and how well it was going, and also wanted to thank the collaboration of the hospital and other groups that helped perform those vaccinations. I have received some calls on the jail and the jail expansion and some opinions by others, and I appreciate the opinions expressed here today, and we'll try to consider all of those factors. There are many things behind it, and I've been involved with the process for 26 years, and so there's a whole lot of factors to it, and I understand the opinions you all express, and possibly some things that can be done. And there's also been changes over those 25 years in regards to mental health and the assistance in mental health and the money that is provided for mental health. So I'm trying to look at all those things, and also the information I get from others. So we will consider that. I appreciate you coming.
Anything, Jennifer, you have anything?
Just to echo what everybody else has said about the vaccine clinic, is just quite impressive. I've referenced that it runs like a well-oiled machine. I was out there last week and got to hear words like logistics and deployment, and it very much runs very smoothly. I'm very impressed, continue to be. I have also had some constituents reach out to me in the last couple of weeks with concerns about the jail and other things, and I definitely am appreciating to get to learn both sides of the topic, and so I'll be listening very closely and doing some research myself. So I appreciate you coming, and you were both, everybody that spoke tonight was very well organized and had concise thoughts on their opinions, and I appreciate that.
Okay, thank you, Jennifer. Tommy, you got anything?
No, I'd just like to say I'm glad to be back. A few constituent concerns I've had. Some people called. I had a little tussle with the COVID myself, a personal experience, and thank you for all the calls and the prayers and the questions. I'm glad to be back with the guys and Miss Best. So it is good to be back. Also, you know, I've had a few constituent concerns. You know, pretty much took care of. I guess the biggest one is trash. You know, I've had a lot of calls. And we had a meeting earlier about roadside trash, and this time of year when all the foliage comes off, it becomes more apparent because you can see it, and there has been people picking up. I know in conversation with the county manager, some of our jail inmates who would volunteer to go out, you know, during this COVID situation, things have changed, and those are not available. We do have plans. We encourage residents to pick up in front of their house, and if they'd like to take on a quarter of a mile either direction from their mailbox, well, feel free to. Everybody likes a clean county, and you know, our county manager said he grew up in a time frame where the slogan was, give a hoot, don't pollute. That was a nice little slogan. So if you can help with this, we'd appreciate it. And I do appreciate everybody that came and spoke tonight about the jail, and we will consider all these things. I know we have two pastors here. I know my pastor has said repeatedly over the course of my lifetime, he has said if the pastors and the church community will do their job and go out and visit, they would put the penal system out of business. And that's true. So I'm glad we have some pastors here that's concerned, and I hope you reach your community and reach these folks so they don't fall into the court system. And I applaud my pastor for taking that stand over the years of my life, encouraging people to get people on the right path. And I know Jesus' name's been thrown around here tonight. His name's been thrown around pretty frequently. And so I wonder, I too have carefully considered this jail expansion, and I've asked a lot of questions, and I'm continually trying to educate myself, but I wonder what Jesus would do. I mean, did you ever stop to think in his final act as a mortal man, there were two others hanging on the cross with him. Why didn't he take both of them with him? One said, "What must I do?" And he said, "Today you'll be with me in paradise." If we could wave a magic wand and go away, I'd be the first one to do that. But Jesus didn't take that other one with him that we know of. And I too have had conversations with our sheriff. And there are some federal and state guidelines that we have to adhere to. And I know there are certain people that have a misconception that the commissioners here are some type of jail mongers who want to lock everybody up. That's not true. That's not true. And I've had conversations. I know the sheriff was quoted in some of these speeches, and I appreciate that. I'm glad people are communicating with the sheriff. He's a good man. I've conversed with him also, and he said that he wished he had kind of started down this road right when he got elected. And I know some of you folks don't know these statistics, but I've got a few. I have studied. I want to share this with you. Right now, and this is the corner we're kind of got ourselves painted into. Right now, we're the third lowest of 17 counties in beds per capita. Beds per capita. And we're one of the larger counties. And we have state guidelines. These things are passed to us. These requests come from the sheriff's department and the jail system. They bring this to us. We didn't go out seeking to build another big jail. Just like other departments in the county, these folks bring requests to us. I see our librarian person here, very faithful to come to all the meetings. They bring budget requests and needs. This is another one of those. It happens to be a big one. But there are state guidelines that we have to follow on jail capacities. These things come to us. And again, right now, we're third lowest. And that is the corner we're kind of painted into. We're at capacity. You can ask a sheriff. I don't know if you ask him that. But with all the good work that has been done to try to get these folks on the right road and keep them out of jail, it's caught up with us. And as far as spending that money, I want to remind you that when somebody sits down to build a project, it would behoove anybody that's in public service to look down the road at future generations. We're not building this jail to try to fill it up tomorrow. But $16 million today can save your kids and your grandkids maybe another $30 million a few years down the road. Because as the population increases, there's going to be more people that really need to be in jail. Just like that third thief on the cross. There's going to be, sometimes, as bad as you pastors try, there's some slip through the cracks. It breaks my heart. I work with youth. I work in the church. And it breaks my heart to see some of our deputies and some of these people show up on the crime blotter. Because trust me, I've tried. You've tried. Sometimes the very best that we can do, pour our heart, pour our soul into some kid that may be on the wrong road. They will stiffen their neck and they will harden their heart. And the wisest man that ever lived, his name was Solomon. He said that those who will not listen to instruction, correction, those will be suddenly cut down, and that without remedy. Yeah, it breaks my heart. I don't like that. A bit more than anybody else here likes that. Some of these things, and you can see it coming. Some of these things are control. And I want to put down the public perception of a few people that think that we are some kind of, we're in the jail business. No, we're not. These come just like from other departments. They come to us, and we have to deal with it. So that's my feelings about it, and I am still educating myself about all these things. I don't have the benefit of some of the other commissioners who have sat through multiple terms and saw some very big ticket item projects come down the pipe. They're more experienced on these big ticket items than I am, but it's, hey, I'm digging. You know, I want to let you know I'm trying to look at all angles and study all things. And I think, as you'll see in our county manager's presentation, and we'll talk about mental health and recidivism and all that, I think you're going to see in his presentation later, I won't steal his thunder, but there's going to be, he's going to address that. And it's not that we're not concerned about that. You'll see that in his budget presentation. So, can we do better? Maybe. I don't know. I think we can all do better. I think we can do better picking up trash in front of your house and down the road, up and down the side of your road. A lot of people want to give things lip service, but they don't want to get out there and do the work. So there's lots of things we can do better at. And I echo my pastor, my lifelong pastor again. I want to reiterate it. Said if the church will do its job, we'll put the judges out of business, we'll put the sheriff out of business. So I would encourage us all to do better in the arena that we live in. So that's all I've got to say, Kevin.
Okay, thank you, Tommy. Okay, and I'll just say that on the vaccine clinic that we, when on their call last time, Travis was talking about it'd be great if larger organizations could volunteer to help with the clinic. I know it takes about 80 to 90 people to put on these clinics every time. And I know I saw the Register of Deeds and our county manager out there helping with the COVID clinic last time. So I appreciate y'all doing that. But if there's a group out there or some groups or even just individuals that would like to volunteer for the vaccine clinics, those will be going on for a good while. And they could always use volunteers because it does kind of get old day in and day out, if you will. It's a long day and a busy day. So if you'd like to volunteer, just you can contact the county manager's office or Travis Donaldson, our emergency, I guess he's our EMS director now. Okay. We just had a change in that. So if anyone would like to volunteer for the vaccine clinic, we are looking for volunteers to help do that. You know, direct traffic and kind of simple things. Make sure forms are filled out correctly. And then also I talked with Jennifer Shuping today, Greg Shuping's wife, and you know, Greg retired. And he's, I think she said he was flying to Portland, Oregon. And I asked Jennifer, I said, why is he going to Portland, Oregon? And it's like to help them set up their vaccine clinics. Because evidently, I think we were blessed in Haywood County to have employees with a vast amount of knowledge to be able to do that. And Greg's evidently known throughout the nation for incident management, programs and everything. So he went out to Seattle last time. The sheriff was wanting to maybe talk about Greg a little bit, and he wanted to wait till Greg could be here, and he couldn't be here this time, Sheriff, because he's going to Portland, Oregon. So Greg's really busy, and we were very blessed in Haywood County to have that kind of experience, and Greg did retire, but he definitely had us set up, and he's there for us if we need him. So I wanted to give a shout out to Greg tonight for that. And we'll move on to our...
Kevin, can I make one correction?
Okay.
I misspoke. We're the third lowest out of 14 counties in our area. I got to use these, and sometimes I can't. I think we're third out of 14. We're at 17 beds per capita. I think that's on a per 1,000 basis, 10,000 population. And 17. Swain County's got 76 beds per 10,000. So we're kind of painted in a corner, and we're fourth state out of a sampling of 10 counties our size. We're fourth lowest. So. If any of you are wondering if we have a need based on stuff that's handed down to us from the state, you know, there's data to back that up. So.
Okay. All right, thank you, Tommy. Yeah, and just another shout out, I don't always do this, but appreciate the sheriff and the faith-based programs that we've had to keep our recidivism rate and our jail population down, because it has worked. Because when the sheriff went on in 2013, 8 years ago, he thought we were going to have to do and talk about what we're talking about today. But because we did these programs, we do know programs work because we've been doing those programs, and they have been working, and they've been keeping our recidivism rate down. So we appreciate the sheriff being willing to do that, and it's really been at his direction to allow our faith-based groups to come in and do that, and I really appreciate that and want to let everybody know that. Okay, so we'll move on to administrative agency reports and presentations. We have our health director, Garen Bradish, and I'm not sure if our medical director's here or not to give us a COVID update. So appreciate you being here tonight, Garen, and all that y'all are doing.
Good evening, Commissioners. Well, we're almost 11 months in with COVID-19, and so far here in Haywood County, we've had 3,669 cases, and unfortunately, we have had 84 deaths. But I can say that it seems that we've plateaued, and we're even starting to see a decline in cases. Friday through this morning, we only had 36 new cases. Today, we had 19 new cases reported to us. So it's definitely leveled out, and it seems to be somewhat improving and holding right now. As of now, we've vaccinated about 10,000 Haywood County residents. Last week, we had over 2,500 people receive their second dose at our clinics. Vaccinate nearly 1,000 people with their first dose last week. We even went out this Saturday to the Reynolds Community Center in Canton, and we were able to target the African American population, where we got 117 vaccinated. And that was mainly due, even though we've had a decline in our allotment of vaccine from the state, our partnership with Haywood Regional Medical Center has made this possible. They've managed their Pfizer vaccine over a period of time and has been working closely with the county to be able to provide us first doses going on. And I have to say, I really appreciate that partnership. Talking with Marty Stamey and Howard Crenshaw, we want to keep this going for months to come. So really thankful for them. As I'm thankful for all the EMS staff and of course the public health for all the work that's been done, and all the volunteers who are coming out to our clinics each week and helping with that. This week, we have 735 people scheduled to receive a second dose, and of course, we have our 400 first dose, 300 that's allotted to the health department, and 100 from the hospital that we'll be working through. I am planning on submitting at the end of this week with the state a proposed increase in our allotment to see if they will allow us more vaccine. We know that we can do our drive-through clinics. We're very successful at that, and we want to show the state that we have a need and the citizens want the vaccine. If they'll just increase our allotment, we'll get it out there. That being said, I'm going to keep this short tonight, so any questions, comments any of you have, I'll be glad to answer.
Just a comment, thank you for all y'all are doing. I know I'm involved down at the fairgrounds or the Smoky Mountain Event Center, and y'all doing just a wonderful job. And as the vaccines come in, I know you'll get them in people's arms.
Well, thank you. We certainly will.
I have a quick question about the numbers. Where did the unresponsive number, where does that come from?
The unresponsive number was basically, through public health, we've now merged into, we're using CCTO as contact tracers and case investigators. When we were doing case investigations, we saw an increase of people who basically wouldn't answer the calls. We make multiple calls when we receive a positive, and now we've moved more into vaccine at the health department, so we're using basically state personnel to do this for us. And we've seen an increase over time in those that basically when we try to contact them won't answer the call. That's what that number was. That's the number of people that we've reached out to try to provide guidance, give them information, see about doing basically contact tracing, and they won't answer the call.
Gotcha. Thank you.
Anybody else have any questions for Gary?
Garen, I know that you mentioned the allotment that comes from a state, and I know that's been reduced down. Do you mind to touch on that just a little bit? I mean, I know more probably, but I just want the public to be aware of that amount.
The reduction has basically been twofold. Part of it was because the federal government had reduced the number that was allotted to the states because the manufacturers just didn't have as much as was originally thought. Now that's trying to be ramped up, and we hope to see increases. We know that the state has gotten word from the federal government that there'll be an increase for North Carolina, so we hope that's coming really possibly in the next 2 weeks. So that should help with that increase. The other thing is the state made some decisions to move to some regional clinics where there's the one that's been at Panther Stadium in Charlotte. There's been some down in Wake County, also around Winston-Salem. So that has caused some of our reduction. I know that Western Carolina University is about to start a large-scale regional clinic for the West. So it was kind of moving vaccine from counties into these regional clinics.
Yeah, we can do more. We just need to get that to the state, right? We're ready to send it to us.
Absolutely.
Another question I have also is related to COVID. As far as our cases, do you mind to touch a little bit on how we are right now? Are we still seeing that decline?
We are. We're watching the daily numbers. Of course, to see a number like what we had over the weekend and it being so much smaller, where we were having hundreds of cases come up over the weekends, and literally any given day you might have 70, 80 cases, and now to see it down to 19, that's a huge from where we were just a month ago, 2 months ago. So we hope, we know the community's heard the message. They know what to do to protect themselves, wear the mask. And now that we've got a large number of the county wanting the vaccine, we hope those numbers will continue to go down.
Thank you.
Yeah. Thank you.
Great. Garen, just let me say too, this is my 17th year as a commissioner, and by far, I've got more positive comments about the vaccine clinics than I have any issue ever. Positive comments. You have comments, usually negative, but most of the time that's what we hear, in government. But the positive comments have been over, really a lot. So I appreciate all the work y'all are doing.
Well, thank you. We had some big days last week, and it took over 130 people out there working with the volunteers, public health staff, EMS, and the hospital staff. So appreciate everything and appreciate all the volunteers and the workers.
Yeah, okay, great. Too, my mom and dad, my dad's 82. Shot, he went through, and they, I think it took us 40 minutes to get through. And on the news you see about people waiting hours and hours, but it's 40 minutes is all it took. That was from the time we got there till the time we were leaving, pulling out on the Highway 209, and that's just, it's just good for the community. And also I appreciate the way y'all do it, because people can stay in their cars and go through, because older people, it's hard for them to walk into a facility and stand, and then be around other people, whereas when they're in their car, there's very little interaction, and they can just drive through, get their shots, and move on, and they're in their car safe the whole time. So it's just ingenious the way y'all set this up and everything. So I just appreciate it. So okay, and it was pretty fast.
Thank you.
Okay, thank you. Okay, our next item will be our Medicaid transformation, and we have our HHS Ira Dove here to talk about that tonight. Welcome, Ira.
Good evening, Mr. Chairman and Commissioners. Thank you for being here. And I too would echo, it's been quite a partnership, and a lot of people involved, and a lot of thanks owed, including some of y'all here, for all of the wonderful help in coming together to make those vaccine clinics possible, and to the public. a lot of people have been great as they go through lines and wait and stuff. So it's been a really wonderful community effort. And the hospital has been, many of them have gone well above and beyond in that partnership. Now, we talked about Medicaid transformation back in 2019, and we were all geared up to go, and then it stopped around November, and didn't know when it would come back, and so it's going to come back now again, and very soon. They'll start with the enrollment March 15th. That'll go through, and July 1st will be the go-live date for the first standard plan. Now, we'll talk about Medicaid transformation in just a minute, and we'll work on later tonight. There will be another piece on the agenda that relates specifically to the health department and Medicaid transformation. So first off, what is Medicaid transformation? Well, back in 2015, the North Carolina General Assembly decided that they would go from essentially, the way Medicaid is run now, where everybody has a fee-for-service and you would go see a provider, towards a managed care system, which is per member per month for the people who will be running it, but also allows them to look more at coordinated whole care and do a lot more analysis that way. So under the fee-for-service model, DHHS would reimburse your physician if you went in and you had a Medicaid card, and they would just bill Medicaid regularly and get that. Now your physician is going to have to enroll into a managed care system and work to look at a broader array of things when they work in that company, when they work with those companies, as we'll talk about in a minute. Instead of contracting, also the other difference on this is the state of North Carolina isn't who your physician will be billing. It will be these 4 or 5 insurance, or if you're in the Eastern Band is also going to have a tribal option. The reason they switched is to improve the health of North Carolinians through innovative, whole person-centered, and well-coordinated system of care that addresses both the medical and non-medical drivers of health. It would help us to unpack that for just a minute, because whole person-centered is different. When you go to your doctor, than your normal care systems. If you were to go to your doctor now and walk in and you had a certain set of symptoms, they would pretty much treat the symptoms. Now they're looking at a little broader system. Your managed care system is going to look a little more at the whole, and that's even going to go into some of the things that they offer, and we'll get that in a minute from your managed care system. They also will be looking at coordinating care between your sets of providers. That address a system of care rather than just individuals going in and meeting their doctor, and addresses medical and non-medical drivers of health. That's the goal. And we'll talk about some of the ways they're going to address those non-medical drivers of health in just a moment. Now, in North Carolina, there are going to be 5 different health plans. That's true of Haywood County, except for that Carolina Complete Health isn't available in Haywood County. And the 5th plan is only available for certain folks in Haywood County. But WellCare, United Healthcare, Community Plan, Healthy Blue, AmeriHealth, Caritas are the 4 plans that are available for everyone in the county. And if you're eligible for enrollment in this plan, if you're an enrolled member of the Eastern Band, eligible for their Medicaid, then this is another option that will be available in Haywood County if you wanted to choose this, which is the Eastern Indian tribal option. So who's going to enroll in managed care? Well, first we start with you have eligibility for Medicaid. And now we're going to look at the next thing, or health choice, or one of the other related plans. And we're going to talk about different periods in time because you're going to have those who must enroll now, those who will be enrolling in the next year in the rollout or so, and then those who won't be enrolling down the road for the different types of plan. And if you look at where we presently are and just talk about how many people this impacts in Haywood County, we're looking at about 14,917 plus or minus, depending on how many have enrolled or not enrolled in the last several days. That was as of February 1st. And when we get to the point that we have everybody, all the plans rolled out, you're going to look at about 80% of those folks will be in one of these plans when it finally all rolls out that I'm going to be talking about tonight. So until that point, like starting in July, you're going to have, and I'm going to give you a very broad number because the definitions on setups is a little bit to be determined. About 7,500 to 9,000 people when we come in July are going to be into this system, somewhere in that broad picture, but about 12,000 overall when they're done and the tailored plans roll out and the other foster care and the other things roll out. But initially, we're going to have most people in Family and Children's Medicaid, Medicaid for pregnant women, non-Medicare aged, blind, disabled, and North Carolina Health Choice. These are that's why I say those numbers, when we look at the tailored plan, I can't give you an exact description because they've literally just written some of those definitions to determine who would be in that plan versus the standard plan. That's who's going to be coming in. Mandatory, must enroll, and those with a Medicaid card categories will be coming in July. Excluded, cannot enroll in health plan, stays in North Carolina Medicaid Direct. Now, Medicaid Direct is what we're calling the people where your provider is fee-for-service directly billing the state, not in a standard plan. And some of these, so that's your family planning program. It's about 2,400 people, and the benefits are family planning, but it also includes a physical. So that's a real program that they have, and a lot of people qualify that just so they can get a physical. Okay. Then you have medically needy, health insurance premium payment, the HIP program, program of all intensive care for the elderly and refugee Medicaid. Those are some of the programs excluded, and those folks will be excluded, not enrolling in any of the options later. Then we have the May, and that's the persons who are looking for the tribal option we mentioned, or for persons, some of your tailored plan. Now, I've said tailored plan a few times. It's time to put out what that word means. Your standard plan is basically your standard Medicaid plan, and it's going to have your basic whole person care. Your tailored plan is more geared towards high acuity mental health. That's the one of the main features that's going to come in, or high acuity other needs. One of the main features that will come into the tailored plan. And because those plans won't roll out for about another year, then that's determining the amount of people we'll have ready to go in July. Key roles. Now, your eligibility for your citizens will still be determined by Haywood County Social Services at this time. That's not going to change. North Carolina Medicaid is going to provide Medicaid Direct. That's the oversight and supervision of those health plans, and they will continue to provide for the folks who will later qualify for what's the tailored plan for the next year until that rolls out in about a year. Your enrollment broker, which in this state is Maximus, we'll get to how to contact them in a little bit down the road. This is the person that everybody is going to want to talk to so that they can pick a plan. And one of the real reasons that I'm here tonight is to tell everybody, go ahead and pick a plan. Because if you don't, you might get auto-assigned, which is what's going to happen. If you have a Medicaid card and you do nothing, you're going to wind up in a plan. Your doctor may not be in the plan, but you're going to wind up in the plan. And that could be a little issue if you want to see a certain doctor. Maybe your doctor signed up with all 4 plans. Maybe they didn't negotiate with but 3 of them. You want to make sure you're in a plan with your doctor. Or there are some other benefits, and we'll talk about that in a minute, and each one's a little bit different. Each company's offering a little different bennies, and you may want those particular benefits. You might want to pick your plan rather than have it picked for you. So, the enrollment broker will help you look through those different plans. The enrollment broker can help you determine if your doctor is in that plan. That's why they're a very important player in this. Prepaid health plans, those are the 4 plans that we mentioned a little earlier. They're providing the health care to ensure the members are there. The primary care providers, those are the people who are contracting with those prepaid health plans. That's like your doctor, your doctors, hospitals, people that are contracting with those prepaid health plans, those prepaid health plans. Again, our WellCare, United Healthcare Community Plan, Healthy Blue, and AmeriHealth Caritas, also in our county. For certain people, they'll have the Eastern Band Cherokee Indian Tribal option for certain people in our county if you're eligible to enroll for that Medicaid. Local health departments are going to continue to provide services, and community-based agencies may be helping to disseminate some. Now, back in October 2019, we did a really big fair at our office, and we had a bunch of people come in and meet the enrollment broker. Well, due to COVID, we won't be able to do that, so you're going to have to connect with them online if you want them, or at the phone number that's going to open up March 1st. There's an ombudsman. This is a Legal Aid of North Carolina's been contracted with to do this role, so if people want to get more information, they're supposed to be able to help with that, or if they're having issues, they're supposed to be able to help smooth over some of the issues with enrollment or getting people into their plan. Let's talk about that timeline. March 1st, the call center goes live and enrollment packets are going to be mailed out to beneficiaries. That means about, thousands of people in our county are going to be getting these packets. I would advise people not to throw them away. Again, pick a plan because you don't want to be in one plan and your doctor another when we get to the date where they do the auto assignment in May 15th. Because what will happen is those people will probably call our office and try to help to fix it. And it may be as busy as when the COVID lines opened, and we would just as soon, pick your plan now and let's take care of that. Open enrollment begins on March 15th, continues through May 14th. For those who didn't pick a plan, you'll be selected on auto enrollment on May 15th. Managed care and the options launch on July 1st. And the end of the choice period for this year is 30th. So again, some critical dates. Mailings will begin March 1st. This is when current beneficiaries will receive all the details by mail about who can enroll in their plan and what the plans are. And they'll probably get mailings, I would guess, some of them will be getting mailings from some of the companies as well. More companies I named, trying to get them to select their plan. Open enrollment, another big date, begins on March 15th. That's when those existing and newly eligible beneficiaries are going to be able to contact that. The enrollment broker for their choice counseling. This is, like I said, last pretty briefly, because you only have till May 15th until you're auto-enrolled. Going to be the large in-person events, but in a moment we'll give you, some folks some different ways to contact them. Now, auto-enrollment. Again, if you do nothing, you'll be auto-enrolled. You'll be put into a plan, and hopefully your providers have signed up for that plan. They're going to put you into this plan. You will have a brief window of time if you wind up in a plan without your providers and you want to change to do so, and then you'll be in that plan for the year if you have, or for as long as your Medicaid lasts. July 1st. Priorities for day one. And this is important because it's going to help a lot of questions. Day one, your Medicaid is supposed to work. You should be able to go to the pharmacist. You should be able to go to your doctor. You should be able to know which plan you're in. You should have the information to access your services on July 1st. One big thing that I'm going to go into in a few minutes is the Medicaid transportation, because a lot of people access that service through us. You'll be accessing through that if you have that kind of Medicaid at that time through your provider for a large percentage of people. If you're in a standard plan, you'll be contacting those folks. Choice period, 90-day period in which you can change your plan for any reason. So if you don't like your auto assignment, you would have a second option for 90 days to change it. And how do you contact your broker? Online. I would suggest that people go right now to this ncmedicaidplans.gov. You can get a lot of information, and you can look up, I was looking at that. You can look up your providers on some of the things there and see if what plans they're in, if your providers have enrolled. Your providers, for example, we're coming tonight to talk about contracts in a little bit. We're not going to be on this website quite yet, but a lot of providers are already going to be on there. Come March 1st, you're going to be able to use a smartphone app. Call center is going to open up, 1-833-870-5500. That's going to open up on March 1st for people to call somebody and get into the system. And if you want mail, there's even an address to do it that way. So there's going to be 4 ways to contact the enrollment broker and enroll. And again, it's really important that you do. Your enrollment broker can tell you about what each of your plans is going to offer you. They can tell you how to contact your plans. And when I say benefits, we're talking about things like GED vouchers, wellness benefits including gift cards and discounts. Some of these plans offer cell phones. So there are benefits that people may want to talk about. And again, making sure your providers are in the plans. Non-emergency medical transportation. Excuse me. North Carolina Medicaid is required to provide transportation, and this is something that we do for people that have those Medicaid cards. And that's arranged through our office. Now, so if you had a Medicaid card today, you could call up to Health and Human Services, and you could have someone who would arrange to make that trip for you. We don't do the driving, we don't do the provision, but we have contracts with the different companies, and we make sure that they pick you up and follow the regulations and get you to your doctor and get you home and those kind of things. And that you actually saw your doctor. That's one of the forms they have to sign as part of this. For those people in the standard plan, they will be contacting their providers to do that for them. Any questions?
Got one. What if, and I'm sure this will invariably happen, what if somebody does neglect the mail? And they blow through all those deadlines, do they get assigned a provider, or what's the?
Yes.
They get assigned one.
They'll get assigned one of those 4 plans.
Yeah.
That's
Even
what I
if they
don't
don't
know.
respond, something happens to the mail, they
Sure.
just... Yeah.
And if their doctor happens to be in the plan, then that'll be fine for them.
You mentioned that some of the plans were going to be, if they're placed in a plan because they don't respond, it will be geographic and area. Is there a primary for Haywood County?
Geographic and area, being it would be one of the plans that's offered in our geography. They'll be in one of those 4 plans, is my understanding.
So-
There's a 5th plan that's available in areas that's not us.
Okay. So their physicians or whoever they see for their medical care would have to be associated with each of those plans, correct?
Correct. And I think some providers probably will be, but we couldn't guarantee that. But that's absolutely correct. It's just like their insurance plans, and it's going to run like your regular insurance plans. If they've enrolled with that insurance company, you're good.
Okay.
Thank you.
Who's mailing the packets out?
Those are supposed to be mailed out from the state, and I believe the enrollment broker is supposed to handle that.
And the address that they are mailing it to is a previous address that this consumer has?
I believe it's their official Medicaid address is what all that stuff is going to.
Do we know what providers in our area have signed up, or is everyone going to see Medicaid patients?
I don't know that they've all signed up in this, or that anyone, a lot of our providers do already see Medicaid patients, and I don't know that that's going to change. I don't have any information on that.
Okay. I mean, I just wonder, in these plans that are being provided and the providers that are joining the plans, I mean, who's joining it, who is participating, such that the people that have doctors now know that their present doctor will be in this plan or not? I mean, do you know about that?
I do not know which doctors have signed up.
Have you
all
heard
of them.
that some doctors may not sign up to be in these plans?
Don't know that they'll sign up in all of them because, again, they may not. They're different. They may not want the conditions that particular providers throw on you.
Yeah.
So,
Okay. So can you keep us updated on that? Because that's what I'm most concerned about, is because basically they're turning this over to some private carriers, and private carriers are in it to make money, and so it's going to be, I don't know if as a provider they're going to want to participate, and so I guess I'm concerned about that. Is the state concerned about that?
haven't really heard concerns other than around the area that I have heard it statewide, that Medicaid transportation, because the Medicaid transportation, the way that works is the individual providers, and you're dealing with cab companies or you're dealing with bus companies. That's the area I've heard the concern that they may not all join into this. It may be too cumbersome. I haven't heard that for our county, but that's an area around the state that has been discussed.
Okay.
For our county, I haven't heard that anybody's not going to opt into this that's a transportation provider.
Do you think this information is being provided to this program right here that you presented is being provided to the providers in the area?
The information I'm
To the
providing-
doctors and pharmacies in our area, so they know what's going on as well?
I don't know how much they've reached out to the providers. The different companies, because to get the providers to come into the different companies, I know that they've reached out to the health department.
I just
know
wonder
that
if there's a
they're-
way to provide this to the providers in our area, is what's coming. I mean, I'm sure.
Sure. I know a lot of them are quite aware that Medicaid transformation is back on the table, and they were very aware of it the first go round. But we can put information out into our community for sure.
Okay.
Thank you, Ira, for sharing that with us. I guess I'm a little more privy, being on the board. I've heard Ms. Teresa present this before, so I'm a little more familiar with it. But I think the main message we want to get out to folks is to be sure you do something before May 14th. Because on May 15th, that's when the auto enrollment will take place. So I guess for anybody listening or watching, don't wait on the mailing. Go ahead and go online and make that decision now. And as Dr. Patrick pointed out, I guess the biggest concern is their doctors or their current doctors are on the plan. So I would start out to your doctor even, make sure they're aware of it. So just be sure you do something by May 14th.
Yes. Other questions?
All right, for somebody to qualify for Medicaid, what is that? Is that an income level, certain income level?
All of our eligibility programs are going to have that as a component, but there are going to be multiple Medicaid programs. So some of them will also have an age component. Some of them, like pregnant women, that's going to be potentially a different component. Children are going to have different components. And the eligibility, pretty much all the programs I'm familiar with are going to have some kind of income qualifier. Teresa is more schooled in the specifics on each of those programs in detail, but Ms. Teresa Allison is our Economic Services Director, is here with us tonight.
If an individual makes, an adult individual, what generally is the income level? I was just trying to get the word people would know if they don't have. There's something kind of general thing you could throw out, or is it just so specific on family and all that?
I'm trying to remember the new federal poverty guidelines, and it's just slipped.
Come on. Yeah, that's okay. I can't hear you at home. We can, but I can't. Yeah. Just pull that mic down if you need to.
So I would suggest that anybody that's interested in learning more about the income limits, you can go to the North Carolina Medicaid website, and there is a chart there that gives some more specific details about that.
Okay. All right. Good. Thank you. Okay. Thank you, Ira. Is that? That good? Okay. Our next item of the administrative reports is a preliminary fiscal year 2022 budget discussion. We have our county manager, Bryant Moorhead, here. Welcome, Bryant.
Thank you, Mr. Chairman. Commissioners, I was looking over the agenda. I thought Medicaid transformation budget, maybe we would have Greg come up and explain the Machinery Act to you afterwards. This is a very preliminary overview of the budget process. We've just started budget meetings week before last. We have a couple more, but I wanted to bring you up to speed of where we were last year, current year, and things that will be included in the budget, or get your feedback about those things. You've seen this slide several times before, but I think it's worth showing again what we're trying to accomplish with the budget. Outcomes, those that face internal are providing fiscal responsibility, organizational excellence, trust, and transparency. We continue to try to attract, motivate, develop, and retain high-quality workforce. Without a high-quality workforce, we can't serve the public. And to support decision-making with timely and accurate data that enhances planning. I think Commissioner Long cited some data, beds, and I think those kinds of pieces of information help give you all the ability to make better public policy. On those outcomes that face the public that they see every day is safe and secure community health, well-being, education, and lifelong learning, job creation and economic development, access to cultural, historical, recreation, tourism and leisure opportunities, reliable infrastructure, and well-managed growth. I think all of these are goals that we should gear the budget towards, and if we come close, we'll have a good budget to serve the public. This is an overview of last year's general fund revenues and expenditures. You can see that revenues outpaced expenditures by about $2.7 million, so we added $2.7 to fund balance. This was sort of up in the air because of COVID. We didn't know what it would do to mainly sales tax last year, but it continued to outperform what we thought. Good news is we added 2.7 to fund balance last year. This shows change in fund balance since 2006. You can see available fund balance, that's the calculation required by the state. We're at 38.6%. Unassigned fund balance is cash free and clear, no strings attached. It is cash that the Board of Commissioners has total control over. It is about 23.14%. It dropped just a little bit from 19 to 20, but it's still very healthy. There's a lot of counties that would kill to have that unassigned fund balance percentage. If there's any questions, don't wait till the end. Just let me know. We can stop and answer those if you have anything.
Why do you think there was a little bit of a dip there? COVID?
It didn't dip much, but if you'll remember, we pulled out about $700,000 to buy some voting machines. That was a big chunk of that money that we had to have before the November general election. The last time we heard from a rating agency was in November of 18. They gave us a AA3. That's a very high rating. It's not the highest. AAA, of course, is the highest, but we're right there in the ballgame. At AA3, they would consider us to be very high quality with very low credit risk. I think having reviewed our finances recently with a financial advisor, we might get an uptick to AA2 if everything continues, which would really help interest rate. The difference in AA3 and AA2 is about 0.25% interest. Doesn't sound like a lot, you know, on a but when you're talking about $16 million for 20 years, 0.25% interest adds up quite a bit. And the factors, they said, were healthy financial position, our debt was good, and we had a low pension liability. So I think those things have only improved since November of 18. The debt profile referenced is this. This is just a graph to 2042. We have debt out further, but I thought I'd show you the next 20 years of debt. You can see we spend about $2.5 million this coming year, and it's down to about 2027, where it drops to $832,000 a year. Been a lot of talk about the jail expansion, so I wanted to lay in what the debt will look like compared to our existing debt. This doesn't include the debt we just approved for Haywood Community College and the nursing building, because we have a revenue stream to pay for that, so I wanted to give you an accurate view of that. And it also doesn't include the central office funds that you all will consider later tonight. So you can see the blue line was our existing debt. The new debt is an increase, but it's still manageable. And over the next few years, the debt will continue to decline. Questions about that graph? This is simply just a general fund history. You can see since 13, it's grown a little bit. The current budget, we budgeted $88 million adopted. It wasn't really that much over actual 2020. There was a question about actual 2018. It was $87 million. That was because we received the hospital proceeds that year, so that was a little of an increase. Let's talk about our major revenues. This is sales tax collections through December. You can see in FY20 last year through December we brought in $4.2 million. Based on historical trends through the end of December to meet budget, we would expect $3.4 million. And remember, we tax projections significantly because of COVID. We didn't know what it would do, so we dropped those about 10%. But you can see the actual this year-to-date is $4.8 million. So we've overperformed where we expected to be by $1.36 million year-to-date. Now, we were very conservative, but we're still $532,000 over last year. And I don't think anybody saw an increase of 12.4% sales tax over year. You know, in the best years, we've seen 7% before. So this is kind of an outlier. I don't think 12% sales tax is amazing. In 18 years in North Carolina, I've never seen it grow to this level. Questions on sales tax? Property tax, we set the budget at just under $41 million in property tax. And because we received the majority of property tax in November, December, and January, we would expect to have been about $31.1 million at the end of December, $30.6, about $500,000 less than where we'd expect to be. But I think Greg, in his updates to you, had said, you know, just a little bit, but the mail being delayed had caused some problems. We know we closed the gap in January, and I'll give you those numbers at a future budget presentation. I'm not too worried about it. Out of $41 million, $500,000 is not something that we need to really be worried about at this time. And sales tax is exceeding it, so we're in good shape. Motor vehicle tax, we set the budget at just under $4 million, so based on trends, we should have brought in about 1.9. We're at 2.1, just $235,000 above where we be, but it's significant in that it's not a decrease. You know, it actually postponed when property tax on vehicles was due because of COVID, and we were worried we would lose some money. So we're actually in good shape, and if the trend continues by the end of the year, we'll beat budget by about $300,000. Any questions on the revenues? All right. Let's talk about health insurance. You can see in 19 was our last crescent. We spent about $9.6 million. 6 months of FY20, we had switched to Aetna as our provider, and we spent $9 million. So we saved about $600,000 from prior years. The trend is showing for next year at $10.3 million. Now, part of that is, I'll show you in a different slide, we didn't increase our funding of health insurance for FY21 because of COVID. We were just trying to have a very conservative budget. We've had some bad experience this year, so we're going to have to up it about 8%. But the national trend is about 10% a year. So if you annualize our 8% growth, that's really 4% a year. So it's not so bad. It's a lot of money, but we're still outperforming what most people in the nation are doing. I'd like to show employees per thousand population. Lots of times you guys will get asked, why can't we do more with less? Well, we are. You can see we had about 9.06 employees per thousand in 2010, and we actually dropped it from 19 to 20 down to 8.3. So as far as employees go, we're holding the line. But we'll talk towards the end of the presentation about some things that are not getting done to the level that citizens expect. This is just a graph to show you where the positions have changed over the last few years. Budget's not just a chart of accounts. It shows what's important to you. And public safety has grown by about 34 positions over the last 11 budgets. A lot of those are deputies, paramedics, telecommunicators, those things that people expect when they call 911 that we send someone. This is our largest expenditure, is compensation. The blue line represents what we provided to employees as far as the cost of living. The red line is the consumer price index. This doesn't include merit because in some of these years we gave both COLA and merit. But I wanted you to see the cost of living versus what we've provided. And if you total all of the blue lines up, we've given about 7.5% over this time period, but the CPI has actually increased about 16.7%. We're off about 9%. The good news is in fiscal year 20 and 21, we beat the CPI those years. So we're starting to move the needle in the right direction. I think that was your all's direction to me, is to take care of employees. In the last 2 years, we've tried to do that. Questions on that? Okay, budget drivers for next year. And this is, it's early on, but these are the things that are out there simmering. We know we made a commitment funding formula for the school system for 3 years. We did that in 21. That will continue in 22 and 23. It's 2.75% increase on the per pupil funding. I worked with Dr. Nolte last week. He's putting together his estimates. We also will fund the college operating. Talked to Dr. White and told her my target is around 3%. She's going to work with her structure to see what kind of budget they can bring back. You'll remember last year we received several requests from the Sheriff's Office for telecommunicators. We didn't fund those, but I think we really need to revisit that. I haven't met with the sheriff yet, but have good conversations with him that next week we'll get a request for some telecommunicators. And I've talked with Ira about Health and Human Services, the need for especially school nurses and some other positions. One of the things I think Commissioner Long brought up earlier was about a pretrial program. This is the sheriff and I have talked about. I've talked with Judge Letts, and Ira and I have talked recently about developing down on recidivism. And this is, treatment. We're talking about mental health and physical health, but also working with the college to help with GED classes and things like that, that maybe we can break the cycle of people coming back to jail. And I think back before 2009, the county had a jail navigator. It was funded through the state funds, but when the state cut those funds, the position went away. It's worth revisiting that position. It's someone like a social worker in the jail day in and day out that learns who those people are and can then link them to services. And that gives us a shot at reducing recidivism, because repeat customers cost a lot of money. And so we can change the behavior, give them a chance to improve their lot in life, but also cut down on our jail population. So that's something we'll work on. Like I said, health insurance, and I struck out 3.7. That was our target last year. So I wanted to leave it there to show we're basically doubling last year's because we didn't fund last year's, but that's the cost. You'll remember employee compensation. We didn't do COLA or merit, but we came back and you guys just funded that in January. I think employees greatly appreciated that, but also we delayed the classification study. Meeting with you, you told me, let's get that classification study done. So Kathy and I have been working with Evergreen. They hope to have us a plan back by the end of April, so I can include it in the budget sometime in May. Vehicle replacement, this is just ongoing. It's for the sheriff's office, he needs between 9 and 12 vehicles every year. We know the other departments, we're looking at 15 or 16 cars a year. That doesn't include ambulances. So that's something that we continue to try to manage. We've got some aging IT equipment. We're going to have to, we replaced some this year. We know we've got more next year. And then in 23, as you'll see, we've got a complete revamp of our system. And then building and grounds maintenance. I think Chris has been to you about buying some HVAC units and those things. Those things are just recurring funding we have to keep in the budget. Any questions on the drivers? Okay. CapEx for this coming year. I left the EMS base in Clyde. I've marked it off the list because we were able to get the CDBG funds to take care of that, as well as using it for the shelter. As soon as the state sends us the money, we're ready to get cracking, but we haven't got the funds yet. Nursing building for HCC, the financing closed a couple months ago. I think they have a groundbreaking plan sometime in March, so that one is a big win. You know, the statistic was 90% of the graduates from that program get a job in our hospital, so, you know, that's economic development. So it's a big win. Jail expansion, we know that we're doing some site evaluation right now, but we'll probably be back to the board and ask for architect and engineering fees before the end of June. That will put in a financing plan sometime in late 2021. Probably October, November, we'll have to go to the LGC to borrow the money. And we'll have loan payments next year. So in the current year budget, we cut out the renovation of the Wayne Library. To remind you, the plan was to use the Ross Trust funds that were given to the library system and match that with county funds so we could do about a $600,000 renovation of that facility. That plan is still in play. I think we know we have some upgrades to the bathrooms, paint, carpet, you know, some lighting, some of those things to get the library kind of modernized. And then public safety radio tower. Joey has been working with Motorola to get some estimates. We've found a site. We're working to figure out a tower. We've got estimates on having commercial power, buried commercial power to that site. So we're getting close. Those funds will be in the upcoming budget. On those?
On the EMS base, when do we expect to get that grant?
I was bothering David just last week. We're not sure because associated with that grant were rental assistance through Mountain Projects, and we'd love to get those funds so we can give those to Mountain Projects to help some folks out. But as of last week, we didn't have a firm date.
Holding that up. Okay. Then the library construction, we're going to try to move forward with that this year.
Yeah, it's a good point because we have the Ross Trust funds. So I've asked Kathy to provide to come to the board in March so we can start working on some of that, and then we'll put our money into play July 1. So
how much will that be for 1 point?
I thought it's about $300,000 is the ballpark. I'm not sure if it's a little more or a little less. We're trying to hash that out.
Okay, 334,000. So that's in the Ross Trust
financing budget.
So that's what the Ross Trust had committed to that. So we agreed to match that.
Outlying years, just thinking what, things that we'll tackle in FY22, but things that will be with us going forward past that. The debt for jail, but also jail operating. I think when Commissioner Long mentioned we're not going to fill it up right now because it's designed as pods, we will have to incrementally add positions as we have to put inmates in. But that's something, there will be an ask. And I think, it's supposed to meet our needs for the next 25 years at full-blown capacity. It will be about 20 positions, maybe 25, but that's many years down. So I don't know if I'll talk with the sheriff next week to see if we'll have an increase in detention officers for FY22. Increased costs, we know that the classification study will show us how far we are off from market. It may be that we can't afford to get there in 1 year. So we may have to go 1 year or 2 years, maybe 3, depending on how big the number is. But those costs will be with us going forward. It's not like it's a 1-year fix. Mentioned the server and storage upgrade. This is data storage, not shelving. We're probably looking somewhere in the 7-figure range. It's a big number. It will completely revamp both of our data facilities. And just increased demand for services. We saw a drop in EMS calls in March, but they came roaring back. We're continuing to grow. More and more people are moving here and need our services. So we know that we're going to have to tackle in outlying years increased demands. So some more budget dates. April 19th, and all of these except one are regularly scheduled board meetings. We'll have a work session and ask the college and the school system to attend to present their budgets. We'll have a work session on the entire budget in early May. Hope to present to you the budget May 17th. The manager recommended. The Tuesday we will have a public hearing and then hopefully adopt June 7th. That's basically all I have for you tonight. Be glad to field any questions or getting feedback.
Just talking about the sales tax, about 12%. Do you think it has anything to do with the pandemic that we're in? Maybe people getting a lot of honey-do jobs done and mulch putting down around the house and all that stuff that they've let go for a few years that they had to do. Do you think that is sustainable? I mean, what's your opinion on 12% growth? How's that going to go next year? Just your guess.
As we said about this time last year, I want to miss it. I don't want to ever estimate 12.4% growth in sales tax and miss it. I'd rather be conservative and have more money at the end of the year than we had hoped. Lowe's is a great example because we had so many complaints early on that there were so many people at Lowe's, but they were all doing the same thing. We're doing yard renovations and painting. It's been pretty amazing. And there was also the theory that everybody was receiving unemployment pay at a higher rate than they would have earned, and they were spending that money. But when those payments stopped, we haven't seen a drop off in spending. And not to get down in the weeds, there's an 39 sales tax that is all point of sale, and it's trending the same way. It's not that people in Raleigh are buying stuff on Amazon and we're just benefiting. The sales are happening here in Haywood County. Now, it could be that, Commissioner Rogers is ordering a lot of stuff from Amazon, but we're still getting the money. And I don't know. I've never seen growth like it and can't explain it.
Well, I know my wife does, that's for sure. I think, too, though, you think about, let's see what Tommy's talking about, but then restaurants weren't open and they charge sales tax coming in. So I think the economy is just really good. I mean, here it is. It seems to be. I think it's really good. I hope it continues. It sure is a lot better to have a little extra than not have any, because we crossed those roads, 10 years ago. It was pretty slim.
Good information on our fund balance and sales tax and everything else. I never thought last year at this time, or maybe in March, more in March, that we would be in this position. So it's good news. Just one thing I wanted to add about the communication tower. I know we said we was going to budget it for this coming year, but if we get the information we need, earlier, I want to go ahead and move forward with it, before our budget season starts. And I'm sure we'll do that, but I just wanted to make that known that if we get the information we need and we can make the decision earlier, we will move forward.
Certainly.
As far as the library, I was wondering, will there be any technology upgrades at the library with the budget we're talking about?
We actually have a meeting scheduled next week to kind of chart out all of the projects that we need to get to. I think the COVID has shown the need for libraries may have changed. We have a huge amount of folks doing curbside pickup for books, but also the number of electronic resources has picked up. So I think we'll have to invest in technology in some fashion, for sure.
Because I know, we talked about before people going for job interviews because they have high-speed internet and they can go there and do job interviews, different things, and I was just wondering if we were looking at that as part of it.
Brian, I just want to emphasize, I know we had a meeting about this the other day, you and I and Mr. Boyd, and there's some questions about whether FEMA is going to reimburse us on some of these COVID expenses. We had that discussion, and it's a legitimate concern. We got 3,000 some counties, 3,300 some counties across the nation, and we're one of them. And there has been, piles of money spent with the promise that we're going to get reimbursed. But as you know, things can change in Raleigh, in Washington, and they can just, one stroke of the pen, pull that off the table, and we're hit with an unfunded mandate, basically. We won't be getting reimbursed. So I appreciate your caution, your conservatism about not just going on a spending spree, but basically going on our bare needs on a lot of things. And so I would encourage, again, y'all to continue on that track. Again, like you said a minute ago, it's better to, you know, be wise and not shoot the moon. So we don't know. I just appreciate, I just want to let you know I appreciate that way of thinking from you guys.
Thank you.
Right, one other thing I want to mention as well, I know that we've all talked to you about our budget goals and stuff like that, but one thing I might like for us to focus on is while we're doing all the broadband, you know, discussions and talks about how we can get it in the homes, maybe look at maybe having more areas throughout our community to have folks to where they can come to a certain spot in a community to where they can get that broadband service that they need to do homework or do an application or whatever it is. So maybe that's something we could explore or look at. I know we've got several throughout the county, but maybe we could look at expanding that.
Sure. I don't know if Brandon's heard about it or not, but did you hear the news that we're going to get a little over $7 million, or Charter partnered with that? That's a step in the right direction. So, you know, maybe they can build some of their system out, you know, and help. So I think that news just came in over the weekend, basically. So
I think it's going to take a while from what I'm
oh,
hearing.
it'll take a while to build out that. It won't just. I told somebody I wish the wheels of progress turn, but they don't turn as fast as drive through at Chick-fil-A a lot of times. So.
Nope, that's right.
We could rephrase that now as smooth as our Haywood County vaccination services, right?
That's right. You could use that analogy.
And we will be continuing with our employee, trying to get them correct.
That's important.
Correct.
When did you say we'd have that study back?
We're hoping for the end of April, but I told the consultant, let's get it right and not rush through it.
That's right.
We haven't done this in about 20 years, so we need to make sure the approach is reasonable so we get the data right. If it takes a little longer, so be it.
I think that's real important. I say a job solves a lot of problems, and a good job will solve even more problems. So it's makes me feel optimistic that we're looking at the people that are the boots on the ground in our county and taking care of them first. Yeah. And I'm excited about the library. I have several people ask me about that, so it's good to know that that's on our radar too.
Yeah.
Yeah, and good employees, I think it showed in the vaccine clinic that we've had, that really proves that we need to have good employees, and it really makes the county run smoothly when we do, and having them compensated properly.
All right. Thank you.
Okay, thanks, Brian. Is there any discussion or adjustment to the agenda? Okay, I'll move on to the consent agenda. Does any commissioner have any question about any of the items in the consent agenda? I'll entertain a motion. We approve the consent agenda as presented.
So moved.
Is there a second?
Second.
Is there any discussion at all? Okay, all those in favor indicate by saying aye. Aye. Okay, anyone opposed? Okay, that's unanimous. Okay, we'll move to our regular agenda, and our first item in the agenda is a request approval of budget amendment from the library for $27,158 to appropriate fund balance in the amount of the library E-rate funds that were received in fiscal year 2020 and were unable to be spent due to COVID-19. We have our library director, Kathy Vossler, here tonight. Welcome, Kathy. Appreciate you hanging around.
Thank you. Good evening. So the public library has participated in the federal E-rate program for schools and libraries since 1997. Basically, we pay in full for broadband services, for internet connections, and then we qualify for an 80% discount. That's provided we follow all the rules and regulations of this federal program, which is not easy. The discount rate is based on our rural status with the Census Bureau and also the poverty level of the schools using the school lunch program numbers. So in September of 2019, we received just over $27,000 in reimbursement. We wanted to that in April of 2020 to spend the reimbursed funds, but were asked to wait due to COVID. So we're requesting that money again, and the money is being spent on several different things, one of which is some computer equipment for mostly the Waynesville Library, also some shelving, book carts, some security pads for our radio frequency security tags, a new desk, and we're also devoting about $11,000 toward our print materials budget, which was cut this past fiscal year, and also toward digital materials. We've seen about a 60% increase in use of ebooks and audiobooks due to COVID. That's significantly higher than even the national average. So the library is getting a lot of use, and now we're talking about our digital products as our new digital branch. That's kind of a buzzword nationally because the digital are in demand.
Anybody have any questions for Kathy?
Kathy, are you seeing an uptick in users? I mean, you kind of alluded to that, compared to year over year.
Digitally, absolutely. It was funny, we were going to purge some library cards that we thought were inactive, and we found out that they were not inactive. These people were not physically coming into the library, but they were using our digital services. So that was encouraging to find out. We're still seeing an increase month over month now with people coming back to the library, but I think as Bryant mentioned, we have had great popularity with our curbside pickup, and that's something that I'd like to continue even after we fully open again.
Any other questions for Kathy? Hearing none, I'll entertain a motion that we approve item 1 of the regular agenda.
So moved.
Second.
Any other discussion? All those in favor indicate by saying aye. Aye. Okay, anyone opposed? Okay, it's unanimous. Thank you, Kathy.
Thank you.
Our second item of the regular agenda is to request approval for the county manager to sign provider agreements for the Health and Human Services Agency with AmeriHealth, Caritas North Carolina Incorporated, Blue Cross Blue Shield of North Carolina, United Healthcare of North Carolina Incorporated, and WellCare Health Plans Incorporated related to the Medicaid transformation. So, Ira, you're up again.
I am up again. And Mr. Chairman, took a moment to peruse the state website again and try to get a little information, but I'll get onto this topic first. But depending on the program, some people in our county, for example, if you had a couple of kids under 6 in your home, it may well be worth and checking with us if you didn't have other insurance to try and get them insurance at an income level. The income levels would be fairly substantial in certain Medicaid programs that cover just children for our county role. So it'd be worth a phone call if you had kids that weren't insured in your home.
Okay.
But to look at this one, North Carolina Medicaid transformation means that our public Health Services Division is going to have to contract with these 4 providers as well to provide some of these Medicaid services. And the state laid out in their request for proposal for these companies a lot of the standards that they would have to do and we would have to do. and each company, of course, has their own set of contracts. So we hired, in addition to having Frank Queen review everything, we also hired outside counsel to look over all of our contracts that specialized in medical insurance contracts, and worked with a company to do that. So we're asking for permission for the county manager to sign the agreements.
Anybody got any questions on that? These are the 4 companies that we talked about earlier. Okay, I'll entertain a motion. We approve item 2 of the regular agenda.
So moved.
Your second?
Second.
Okay, any other discussion? All those in favor indicate by saying aye.
Aye.
Okay, anyone opposed? Okay, it's unanimous. Thank you, Ira.
Thank you. Y'all have a good night.
Yeah, you too. Thank you for coming. Okay, the third item of the regular agenda is to request approval of a resolution for the Haywood County Board of Commissioners approving an installment financing contract, deed of trust, and other related for the renovation of Annex 2 building, which is the school administration office in the future. County Manager Bryant Moorhead and Interim Finance Director Kristen Owen present that. Hey, Bryant, go ahead.
Thank you, Mr. Chairman. You have the resolution before you. The school board took action last week. They've conveyed property we call Annex 2 back to the county so we can collateralize it for the loan. We also have signed what we call an agency agreement that gives the school board the authority to complete the project, the construction project, and gives them a lease for the facility until the loan's paid off, and then we'll actually transfer the property back to them. This is requirements by the bank and the LGC. Other than that, the financing was up to $2 million, 5 years, 0.99% interest, fantastic rate. And there are some closing costs that to pay for that. But all in all, this has been a good project to work with the school board and
That is an interest rate.
Yeah.
0.99%,
Yeah.
less than 1%.
Yeah, and if we get that bond rating
At what?
approved, it may.
Maybe 0.75.
Yeah, it would.
they'll be paying us to borrow money.
That's true.
There you go.
I appreciate our finance staff. I know they've got a lot to say, and Julie probably, and Kristen, to get that down where it is, and it really pays to have good employees and to pay them well. So to make sure we're getting advantage of everything. Okay, so does anybody have anything else? See, I'll entertain a motion. We approve item 3 of the regular agenda.
So moved.
And is there a second?
Second.
Has anybody any discussion on it? Okay. All those in favor indicate by saying aye. Aye. Anyone opposed? Okay, that's unanimous. Okay. Okay, our next order of business is appointments, and we don't have any of those or closed session. Is there any to bring before the board tonight? Okay, hearing none, I'll entertain a motion. We adjourn.
So moved.
So
All those in favor indicate by saying aye. Aye. Okay, we're adjourning. Everybody be safe out there.